Good evening. Good evening. Good evening. Well, let us begin this evening. This is the AAUW, the American Association of University Women. And we are presenting this evening several different things. First of all, I'd like to welcome you all to be here with us this evening. We have a beautiful day. The sun is out and it's a little crisp, but it's gorgeous. Welcome to both our members, and we have guests this evening. Thank you for joining us. And we see the United Nations Association is representing this evening as well. We're happy to have you present with us also. Thank you. And our delightful treats. It's so nice to have that. Next month, we are going to be meeting at the SIU library, and we will send out more information about that later. If you'd like to be a guest to that meeting, please watch or connect with us. If you are a guest this evening, look around and talk to some of our members. We'll help you with that. We had two presentations that were planned today. One of them was not able to make it, and we have a member who has worked very, very difficultly, let's say, for many weeks now to present this program. And we were hoping that she would be able to join us as well, but she's not. And they have sent a letter. So in regards to Olga Widener, who has worked very hard to present this, we're going to read this for her. This letter, it says, "Thank you very much, Mrs. Widener," is how it's titled. "Thank you very much for your recent invitation to speak at the American Association of University Women meeting at March 19th of 24 in Carbondale. However, due to my present schedule in Washington, D.C., I am unable to attend. The American Association of University Women was founded in 1881 and is a nonprofit organization that advances equity for women and girls through advocacy, education, and research. It has since evolved to becoming the leading voice in advancing gender equality in education and workplaces everywhere. I commend you for your organization and the hard work and dedication that your members provide. I wish you all of my best at your upcoming meeting. Sincerely, Tammy Duckworth." And our thanks much to Olga Widener, who couldn't be here with us tonight. Also, welcome to all the Zoom people that I don't see, but you see us. Welcome, and we're glad to have you present with us as well. Martha, I'd like to turn this over to Martha now.
Well, and I have to thank Senator Duckworth for saying those nice words about AAUW, which is part of what same thing. We are an organization that was founded in 1881. AAUW was the is the Association of American Women, but just uses the initials now. We are not all women, and we are not all in universities, but we have the same goal. It's a leading voice promoting equity and education for women and girls. We have more than 170,000 members and 1,000 local branches, of which Carbondale is one. Mission statement is very simple: gender equity and economic security. Anyone with an associate's or equivalent degree from a regionally accredited institution may join, although again, there is a proposed change to the bylaws coming up again this year to just take away that requirement and say that anyone that shares our values is welcome to join. And the degree shouldn't make that much of a difference. AAUW has published hundreds of research reports, supported academic achievements of thousands of scholars, provided fellowships, grants, and awards, and funded pioneering research on women, girls, and education. The Carbondale Branch was founded in 1927. Oh, we're looking at a century almost. And our core mission is to advance gender equity for women and girls. We host monthly programs like this one, open to the public. We also award scholarships to women students at SIU. Again, we welcome anyone who shares our goals to join AAUW. If anyone is interested in more information, in fact, if anyone here tonight that is not a member that would like to join, there is a special on the first year's dues. The National has that for the first year. And you could see me afterwards. And also I would welcome anyone who wants more information. Please follow us on Facebook. We have a very active Facebook page, Carbondale Branch AAUW. Thank you.
Hello, everyone. It is my pleasure to give you a few comments about the United Nations Association of the United States of America. So that association is considered to be a movement of Americans dedicated to supporting the United Nations. UNA USA of Southern Illinois, our local chapter, is one of over 200 chapters in the United States that collectively represent over 20,000 members. We are committed to global engagement, and we nurture the belief that each of us can play a part in advancing the vision of the United Nations by way of educating, inspiring, and mobilizing Americans. The most public image of our strategy for advancing such a mission is through the United Nations 17 Sustainable Development Goals. Tonight's meeting is an example of how we collaborate with other community entities to advance our shared goals. So we invite you to join UNA USA to help us advance that mission, that of supporting the United Nations. A few of our local leaders I will name are Olga Widener, Cindy Bies, Pam Umloff-Brown, Phil Eberly, and tonight's speaker, Elaine Jurkowski. So, as segue, I'd like to share a few things with you prior to Elaine coming up to speak with us. Elaine Jurkowski is Professor of Social Work and Program Director of Gerontology Programs in Social Work at SIU. She holds joint appointments in health education and SIU Medicine's Family Practice Residency Program. Dr. Jurkowski's published articles have focused on health disparities, access to mental health and healthcare services, aging, and disability issues. She is widely traveled, and her work and consultative assignments have included Egypt and other settings in Africa, India, China, and Russia. With her profuse academic endeavors, Dr. Jurkowski also has broad involvement in community-based organizations, often serving on boards that range from caring and counseling ministries to the United Way, and lots in between. We are so proud to have Dr. Elaine Jurkowski tonight as our speaker on healthy aging for women, achieving health for all through practices and policies. And we can truly say for AAUW and UNA USA, she is one of our own, a member of our organization. Thank you.
Thank you, Ella, for that very gracious introduction. And it's very nice to be here amongst both groups, AAUW and UNA USA. I have been a longstanding member of AAUW, and I have not been able to necessarily come to meetings, but I do try to get to at least one thing a year. So this will be, I generally try to come to the wrap up because that's always a fun meeting. So tonight I want to talk to you about healthy aging for women and achieving health for all through practices and policies. And so our next slide gives a few snippets of what I'm going to talk about today. I have a video clip that I'm going to start with. Then we're going to talk about the social determinants of health, as Ella started to share. And this presentation is going to focus on 2 of the SDGs, Sustainable Development Goals, that is. One is global health and well-being, and then gender equity, and how can we achieve gender equity and health for all. And then I'm going to move and talk a little bit about policies and programs that impact women and our overall health and well-being. And following that, we'll talk a little bit about advocacy strategies to push that envelope and have a bit of a summary and wrap up. And I'll leave a little bit of time at the end for questions and answers, because I know here at the library, they're very particular about our closing time too. All right, so I'm going to start off with a little video clip for us that my handy assistant over here will help with.
When we think about the issues that impact women today, a problem that might easily come to mind is the gender wage gap, or the difference in pay between working men and women. However, did you know that there is another gender gap? One that affects the health and well-being of women and girls around the world? When we think about the issues that impact women today, a problem that might easily come to mind is the gender wage gap, or the difference in pay between working men and women. However, did you know that there is another gender gap? One that affects the health and well-being of women and girls around the world? Despite rapid advances in the field of medicine over
I can fill the time. It's funny because people with students, they love entertainment. So you always have to throw in some video clip or YouTube or something to kind of keep it rolling and to keep them engaged. Well, it's okay. I can. Oh. So it's okay. So the video kind of goes through some of the areas that lead to gender gap. So the wage gap, of course, is one. A second area, though, that's really paramount is that much of the research has been done on men, right? And so, one of the problems we have as women is that the literature is focused on, they usually, say people of whatever age, but the preponderance of people who have been in those studies tend to be males as opposed to females. And they tend to be from urban centers.
When we think about the issues
puts
that
us
impact women
at a greater risk, so to speak, of really being left out because we are living in a rural area. So then, you go and you push that out more further globally, and women in more poorer socioeconomic status areas tend to get entirely left out of a lot of that research. So, I think we have a long way to go in terms of really trying to understand some of the unique needs that women have and present because of those needs. Another thing that we're facing now is that, once upon a time, like at the turn of the 18 to 1900s, there were almost twice as many men for each female. And now you fast forward 100 years and we're seeing almost the opposite. The lifespan of women tends to be longer than men. And so, at the age of 60, we already have more women than men. But if you move up to, like, say, the 90s, there's, very few men per 100 women. So, like, maybe, I think the last census was something like 35 men per 100 women. Well, historically, women have been healthier. Now we're beginning to see the trends turn as we've had women in the workforce. And so women probably endure more stress than they did 50 years ago because, we're juggling our career, we're juggling a family, we're juggling, the boardroom as well. So there are a lot more pieces to that. It's more complex. And I think many of the health issues women present, they're largely not listened to and ignored. So that's another big piece. So this video kind of goes into all of those pieces. Okay. So I can move on. Now what happens to our people in Zoom? There are also closed caption. I'm just afraid.
impact women today. A problem that might easily come to mind is the gender wage gap, or the difference in pay between working men and women. However, did you know that there is another gender gap? One that affects the health and well-being of women and girls around the world? Despite rapid advances in the field of medicine over the last century, the needs and physiology of women have been and continue to be overlooked within the healthcare system. Women have been excluded from scientific research and are underserved in fields such as cardiac and mental health. This is the gender health gap, and it is a huge obstacle for all women, especially those in marginalized communities. In this video, you will learn about 4 major healthcare inequities that are currently contributing to the gender health gap, and how you can help close the gap, whether you're a student, a healthcare professional, or a concerned citizen. The first inequity we will discuss is the gender gap in healthcare research. The exclusion of women in research has been a major historical contributor to the health gap and continues to have an impact today. It wasn't until 1993 that women were required to be included in most healthcare research studies. Studies that did include women before this time were overwhelmingly related to reproductive science, showing a failure of the scientific community to recognize that the spectrum of a woman's health extends much farther than her ability to have children. The exclusion of women from research into other fields of healthcare was also due in part to the theory that the cycling of hormones made them imperfect candidates for research, although hormone cycling takes place in men as well. The result of this faulty logic is that most healthcare research carried out in the 20th century was done on young white men. The implications of this lack of diversity are still felt today. Countless drugs that are still used have only been tested on men, leaving women susceptible to care that is less effective or even harmful. Women are more likely to experience adverse reactions to antihistamines, antibiotics, and many other classes of drugs. For example, antiarrhythmic drugs pose a greater risk of causing a potentially lethal cardiac rhythm in women. This historical exclusion of women from research has not only affected our knowledge of the mechanisms of certain drugs, but also means that the scientific community is behind when it comes to understanding other domains of women's health. Moving forward, healthcare research must fill the gap in our knowledge of how differences in biological sex impact disease pathways and health outcomes. This leads us to the second health gap inequity in this video, the differential care and outcomes experienced by women when it comes to chronic health conditions. On average, women live longer than men, but with a lesser quality of life. Women are more likely to suffer from multiple chronic conditions throughout their lives. By age 80, the number of women experiencing 2 or more chronic conditions is twice as high as men of the same age. Chronic conditions such as autoimmune disorders are a major issue that disproportionately affect the health of women. In fact, it is estimated that 80% of people who suffer from autoimmune diseases are women. While diabetes currently affects more men than women, recent research shows that women between the ages of 20 and 49 have seen the largest relative increase in incidence of diabetes over the last decade. Young women with diabetes are at a higher lifetime risk of complications from the disease and are also susceptible to other health issues, including complications during pregnancy and reproductive problems. Chronic pain is also more common in women than men, especially with respect to musculoskeletal, neuropathic, abdominal, and migraine-related conditions. Though pain experienced by women is more likely to be reported as severe and long-lasting, it is not typically treated as aggressively as pain in men. Compared to men, it is more likely that doctors will consider pain in women as a psychological issue, and this affects the care women receive. Women with chronic pain are more likely to be referred to a therapist rather than a pain clinic for treatment. Cardiac health is one of the foremost domains of the gender health gap. Although heart disease is often considered a man's problem, it is in fact the leading cause of death among women and kills more women than men each year. Despite this, women make up only 35% of those studied in cardiovascular research, and many drugs that affect the cardiovascular system have only ever been tested on men. Lack of awareness of the risk of heart disease in women results in underdetection of these conditions, as women are often unfamiliar with their unique risk factors and symptoms. A prime example of this is the heart attack. Many people are aware of the hallmark symptoms of a heart attack, which include chest pain, pain in the arms, back, jaw, or stomach, and nausea. However, it has been found that these symptoms are more often experienced by men, and that only 1/3 of women experience these symptoms during a heart attack. Rather than chest pain or discomfort, women will often have symptoms such as unusual fatigue or sleep disturbance in the weeks leading up to their heart attack. At the time of the attack, women may experience shortness of breath, weakness, and fatigue, rather than chest pain, pressure, and tightness.
I don't know.
After a heart attack, women are 36% less likely to take part in cardiac rehabilitation, a figure that grows depending on a woman's social circumstances, family obligations, and cultural biases. This leads us to the last domain of the gender health gap that we will discuss in this video, the social determinants of women's health. The health gap is much wider for some women than others.
So we're to talk about the social determinants now of the SDOHs and how that plays a role in health. And so I'm going to revert from the video to just talking with you because I don't want to run out of time. So the social determinants of health concept is actually very old. In the US, we've only embraced it for about the last decade, but it really began in the 1970s in my home country, Canada. And the health minister at that point in time in the 70s was trying to figure out a way to develop a blueprint for health for all. And so he came up with these 5 areas that were important to consider, which are what we currently know as the social determinants of health. And following Canada's kind of use of it, the World Health Organization picked up on it and used it as a framework for other countries around the world. So we're actually a slow adopter in the United States and one of the laggers to adopt it in our framework, but now it's becoming prevalent in everything, especially within the public health and preventative health arena. And in my work at the residency program, it's so interesting because the physicians always turn to the social workers and say, okay, so now what are the social determinants of health that are impacting this person's health outcomes? You know, and what do we need to think about in order to help change this person's health? Not just medication, but what about these other factors like their transportation, where they live, do they have a social support? What is their economic situation? You know, and what kind of resources do they have to even buy food and to pay for their medication? So those things all fit into the social determinants of health. And I've got a little diagram here where I can go over that once again. Advance the slide there. So there's 5 key areas that are part of the social determinants of health. And so, I mean, for example, it isn't just, you know, having adequate money and resources, but it also is, you know, has to do with what's the economic base in the community that you live in. So, you know, you have to think about GNP and GDP and how does that affect people, you know, within your communities. That's especially important when you're looking at places in more global areas as opposed to developed countries like the US or Canada. Access to healthcare. So not just having access to care, but quality healthcare with quality outcomes. That's another social determinant. The neighborhood that you live in and the environment that you live in. So it's not just the environment, but not just the neighborhood, but what about where you're living? You know, are you living amongst lead abatement, or is there asbestos, or what other kinds of pollutants maybe in the community where you are or within your neighborhood? Education plays a big role. The higher educated you are, or the more education you have, the better your health literacy and the better your health outcomes. And so, and then lastly, your social support and your community context. So social support is really important. We're seeing more and more that as women age, loneliness is a huge factor. In England, they have a minister of loneliness. Can you believe that? Yeah. So you have a ministry of health, but you have a ministry of loneliness as well. And here in Illinois, the Retirement Research funded research through the area agencies on aging to take a look at people and their loneliness factor, so we can come up with some kind of interventions. And especially during COVID, that started the hub with the Department on Aging providing iPads to people so that they could communicate with their family and their grandchildren and whatever. But more and more, they're looking at specific types of interventions to help eliminate that loneliness, alleviate it, because that loneliness does play a role in people's health outcomes, especially women. Yes. I'm sorry? Pets. Well, we do see that those pets play a huge role in assisted living facilities, and there's research on that to show that it does help with people's dementia, levels of depression, and communication. Oh, let me just repeat the question. The question was, why did we not include pets in the social determinants of health? Well, I think it's more of a variable that would fit under social and community context. So, you know, these are broad areas, and within those broad areas, you have specific factors. And I would think that pets could be a factor under especially the social community context. That's really a good point, you know? Well, walking your dog leads to actually health improvements too. Yeah, absolutely. So some of this comes from a recent book that American Public Health Association published called Healthy Aging Through the Social Determinants of Health. So if we do a second edition, I'll have to make sure that there's a chapter on pets. Thank you. All right, so the UN Sustainable Development Goals. That's good. I like that. She said pets, not pests. Pests, P-E-S-T-S, pests can also get you energized as well as pets. Okay, that's another diversion we can go on. Especially as women, it tends to bother us more than men. So it helps our reaction, right? Okay, let's talk for a minute about the UN Sustainable Development Goals. You see the 17 goals over there on that poster. Well, in 2013 to 14, there was an international, worldwide kind of campaign to get feedback from every community around the world. And we in Carbondale actually ran a number of focus groups here at the library, here at each of our events. Olga and I kind of spearheaded that project actually. And we put together feedback from our community as to what the priorities were out of a whole range of items that they gave us to look at. And so we were able to send that feedback to our Washington office, and they developed some consensus from material from all over the country through UNA chapters and sent it to the UN headquarters, and they ended up synthesizing it from whatever materials they got worldwide to come up with 17 SDGs. So that's a initiative. Like whenever we talk about SDGs, I love to say, you know, we here had some input in that. So overall, there's 17, as I mentioned. Today, we're going to address goal number 3, which is good health and well-being. And the second one is, the second goal rather is gender equity. So I have a picture of those goals. And there we go. So that's basically the same as the poster over there. And I think there are little postcards that have that on them. So if you're interested in just, you know, kind of briefing yourself on them, there's access to it. You could just also Google UNA USA SDG and you'll see them. So number 3 is, goal 3 is by the year 2030, we want to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and also promote mental health and well-being. And we also want to focus on assuring equity in terms of access to care, quality of care, regardless of where people live, their geography of where they are, and their income. And then the other piece of this is parity between urban and rural settings, and developing, middle income, and developed areas. So, you know, if you've traveled, you know, you'll notice that there are kind of differences and disparities, even going between here in the US and Canada. If you go to a place like, I notice it when I go through the drive-through in McDonald's, the people who are working in the drive-throughs in Canada have a very different smile than many of the people that I see in the drive-throughs here in the US, primarily because of access to dental care, right? Access to dental care. They have now universal dental care in Canada. So, you know, people can get their teeth fixed. And so it's just interesting. Something simple as that. But I noticed, you know, through some of my work, like in working in Africa, some of the poorest countries in the world, people who have access versus people who live in the villages who have access to like triage primary care places. It's just really interesting to see like the health outcomes and how people are surviving and living. Okay, let's talk about SDG 5 for a minute, gender equity. In gender equity, we aim to achieve equality by ending all forms of discrimination. We want to end violence and harmful practices against women and girls. And we want to see that we have full participation of women and equal opportunities for leadership and decision-making. So leadership, means like in our civic government, in our state government, in our federal government, and there's still, we're beginning to see that here in the US, but there are some countries in the world where it's very rare to see women in those leadership positions. So, it's having gender equity doesn't mean just giving people equal pay, but it's equal decision-making all the way around. So how can we promote healthy aging as women? So here's a few things I want to throw out there before we start talking about some of the policies and practices. So in terms of healthy aging, we can volunteer for clinical trials, especially for women over the age of 50. So there are often requests for women or for people to participate in research trials. And a lot of times, we turn our back to it maybe, but now that I've been looking at some of these gender gaps, literature and how much we really are behind, I try to promote as much as I can for people starting at age 50, not 60, not 70, but at a younger age. So we really can see the trends. So a lot of times there's calls in things like public service announcements. Oh, the question is, how can we find out about these clinical trials? A lot of times there's calls for these things. Sometimes it's word of mouth, but I think more and more I'm seeing that message going through to groups like Learning and Retirement. And like the Alzheimer's Association has been looking for people who are healthy at this point to take a look at comparing healthy aging versus people who, they know have developed the issues of, cognition and cognitive problems. St. Louis University does a lot of, call outs for that kind of stuff. So, I'll be on the lookout. And if I see things now that we're talking about it, as I come across them, I'll send a note out to, leadership in AAUW and UNA, just so people are, you at least are aware of it. That's a good question though. Okay, so a second area is to support clinics and best practices that really focus on gender and women. So more and more we're beginning to see clinical practices that are focusing on best practices for women. Like I see this happening at SIU Family Medicine, for example. So as you see those things or you're experiencing them, write it in a blog somewhere or get it out there in one of the avenues that you are involved with, even if it's a letter to the editor or something, so other people begin to read it and they begin to also think, hey, I can also, take advantage of this, or I can speak up and promote it. Because it's by noticing and promoting and saying something that these things will happen. A third thing I have is support and advocate support groups for prevention. And, creating public awareness of topics that promote mental health as well as physical health. So, mental health is an area that we've stigmatized for a long time, but yet mental well-being does have an impact on our physical well-being. And then lastly, I have promote anti-stigma campaigns in various ways. Doesn't have to just be mental health areas, but other topical areas that we tend not to talk about, or we shied away from talking about as women because it was maybe taboo. So now in the area of gender equity, which is goal 5, a couple of things that we can do to promote the gender equity is take a look at ways to support charities, whether they're big or small, that make a difference for women. AAUW is a good example of trying to promote equity for women, but there are other gender equity areas. Be aware of gender stereotypes, recognize them, speak up when you see them being used, and educate others about those stereotypes. And then thirdly, stand up against harassment. So whether you see or become aware of harassment, whether it's in the workplace, at home, in the stores, in your social circles, speak up and raise your voice against it. So I have a network of friends who really love old movies and old humor. You know, so for example, George Burns and Gracie Allen. But much of those things carry those stereotypes that are not so funny, right? Or not so humorous. So I find myself, at one time I would just, you know, laugh along with it. But now I realize that that's not helping promote gender equity. So I kind of have to speak up around it, or suggest we switch over to something else that's more kind of current and topical. So there's just a few ideas around promoting these SDGs. So now I'm going to segue in and talk about policies and practices that do also affect our overall health as women. I have a list here and I'm going to go over them quickly. So we're going to basically talk about Medicare, the Older Americans Act, Americans with Disabilities Act, Caregiver Support Act, and then a couple of others. So I'm going to move on to Medicare for a quick second. The Medicare is designed, of course, to meet the health needs of women and all people who are over the age of 65. And it was originally passed into legislation in 1965. So it's going on 60 years of age. There's 4 parts to it, A, B, C, and D. Part B is preventative services. And a lot of people kind of negate the preventative services piece. When you're 65, there's a well health check that your primary care physician is supposed to promote. And that's once a year. And there's a lot of preventative kinds of questions that go into it and resources that are available to you. Now, I know from some of the research that I have done that there's a very low percentage of people that actually get those well health checks. Yeah. And when I talk to the physicians about it, their response is, well, usually the person comes in and they have a laundry list of other issues that they want to talk about. So I prioritize what is important to them right then and there. And I do away with the well health check. But what's happening is you're missing on a lot of preventative kinds of resources that could be helpful to you, especially educational resources as well. So the comment was, sometimes when you go to your physician, they just want to talk about one thing, even though you bring in your list and you've got 5 or 6 items that are important for you to talk about. But they'll say, well, tell me which one's most important to you. And then, you know, you get your 10 minutes and out the door you go. So that's unfortunate. The well health check should really take about an hour. Yes.
The insurance manufacturer decides what the pay. For why you're there.
Yes, so Ella's comment is insurance is plays a role in what they're going to pay for, and they usually, from Ella's perspective, they go for the codes that are going to be most revenue incentivizing. So as women, it's important that you don't discount some of the other issues that may be issues for you, because it's easy enough for your physician to forget about it because they've dealt with like one thing. And I'm not done with my list yet. That's what you say? There you go. The supplemental insurance plans are now beginning to, oh, Ella, do you have a comment?
In the United States, it's not well known that every
Correct, yep, yep. There are many women that don't have 40 quarters is right, especially in your age cohort. So that's 10 years of employment somewhere. What about women who have been served jail time or prison time? They may not have it either. Or who work part-time, correct, yep. And women who are homemakers, unless they have their husband's insurance to fall back on, they may not qualify for Medicare either. That is good. So this is another lesson for us about the eligibility certificate. Yes, so one of our guests is saying that it's an eye opener for her because it's just assumed that everybody goes on Medicare, but that's not true. I know from doing work in one of the segments of town here in Carbondale, I was blown away at the number of people that were 3/4 maybe shy. So the senior volunteer retirement program, employment program that is offered through the local area agency on aging, they kind of jumped in and tried in some ways to help those people who were very close top up to be able to work somewhere and finish up their 40 quarters to be able to qualify for Medicare. Because otherwise Medicaid becomes your option, which doesn't have as many options as Medicare available. Although one thing about Medicare is that it does cover vision and dental care to some degree, which is not necessarily the same for Medicare. Medicare only covers vision care if you are at a high risk for visual issues like if you have glaucoma, diabetes, that kind of thing. Yes, you have to see an ophthalmologist, correct. Okay, then we have the Older Americans Act. I skipped over Medicaid. I briefly talked about it. The Older Americans Act was something that was signed in 1965, and the goal of it was to help people get out of the house and socialize. So this is where our senior centers began and our 1 meal a day program where they offered a hot meal to people. And the goal was primarily they found more women than men, of course, were widowed and, needed that socialization. And what's very interesting is now we see a migration from not the senior center, but a lot of in small rural towns, they're contracting with local restaurants. So people go to the restaurant for their meal, and they have their menu card for the senior nutrition site meal, which would be sometimes different than their regular menu because they're also looking at nutritional value. But the nutrition sites have also moved into other areas, which include things like well health checks and health literacy and, giving people ideas on how to stay healthy. Now, the Older Americans Act has also migrated over the years, and they now have things like home-based care, legal services. So here in Southern Illinois, the law school has a contract to offer legal services. We have respite care that's covered. So if you are a caregiver and you need to get out and just have a break, go to the hairdresser once a week or a couple times a month, a respite care can go and help you. We have mental health services or counseling services that are now increasing in nature and demand. And we have like people who go in and do in-home counseling. Talked about senior retirement, RSVP programs. That's also part of the Older Americans Act. So the Older Americans Act also offers a lot of educational kinds of resources. A lot of libraries, and our library included, often has material on the stands that you see that relate to health and health literacy. And that's all part of courtesy of the Older Americans Act and the ARA agency. Then we have the Americans with Disabilities Act. And how does that help us? Well, there's 5 titles to it. The first title is employment. So for many women who are over the age of 60, 65, maybe they're thinking about retirement, but maybe they needed some adjustment to their job because they may have had some. Next slide. They may have had some medical condition or chronic condition, and they have to adjust the kind of occupational trends or occupational resources or adaptations. So that's all covered under ADA. Public accommodations include things like when you go to a restaurant and you have a menu that's got large print, or you go to the grocery store and somebody will help you as you go in your motorized cart around the store. Somebody will help you and reach up and grab things. They'll shop along with you. So all of that's part of public accommodations. The drive-throughs at the bank or at the dry cleaning center in town here, those are all part of public accommodations, as well as going on Amtrak or flying. Then we have transportation. So transportation includes the buses and your railway cars that are designed to be friendly for people who have mobility issues. Telecommunication. So some of you may have heard of Caption Call, and this is a device that you can have installed in your home at no cost, and it has a caption. So if somebody calls you, rather than trying to hear what they're saying, if you're hard of hearing, it's all written there and you can see it. And that's a free service for anyone who's in need of it, and it's funded under telecommunications. Now, we saw closed captions earlier on our screen with our video clip. That's all part of this Title IV of the ADA. And then, miscellaneous is all that other stuff in between. Okay, now we have the Elder Justice Act. Now, this was something that got slipped into Obamacare's Act. So, the Affordable Care Act that was passed during Mr. Obama's presidency in 2010. Well, that document is actually over 1,000 pages in length. And part of the reason it's so long is it includes several other pieces of legislation. And the Elder Justice Act is one of those things. And it has things like adult protection services for seniors, people over the age of 60, long-term care ombudsman program. So if you're in a long-term care facility, there's an ombudsperson who oversees that facility to make sure that your rights are not violated. Workforce training is covered. So I have a geriatric workforce enhancement grant that I've had for 9 years, and we've worked with medical professionals to help them understand issues of older adults and best practices. And that comes from this piece of legislation under the Elder Justice Act. And then there's reporting requirements around elder abuse that fall under this piece of legislation. Then we have the Community Mental Health Act. This was originally signed long ago in 1945, but this provides for community-based mental health services. So here in Carbondale, we used to have SIRS, Southern Illinois Regional Social Services, and that migrated and was taken over by Centerstone. But SIRS was originally developed under the Community Mental Health Act. And we still have what we call a 708 board, and that board takes tax dollars and now awards that money. They used to award it exclusively to SERS or Centerstone, but in this past year, they've decided to share it around and give it to other facilities that are offering mental health services. So for example, Caring Counseling Ministries in Marion, this first year that they've received that money to help pay for services for people who couldn't afford it necessarily. And then a couple of other things, the Patient Protection and Affordable Care Act. I talked a little bit about that a minute ago. It's got the Elder Justice Act linked into it. It's got 10 titles, and one of the things I like about it is that it really pushes for accountability and outcomes, taking a look at outcomes and health outcomes. So once upon a time, if you were in the hospital and you're on Medicaid, you were discharged and you ended up back in the hospital within, say, 2 weeks. Once upon a time, that would be just a normal sort of happening, and the provider would be reimbursed for the services. Now, as a result of this pretty specific legislation, if you are readmitted within a month, the provider does not get reimbursed for their services or care. So that's a part of pushing for, better outcomes, not just throwing people or encouraging them out of the hospital and discharge. Were they denied services? No, they're not denied. They just they just are they're discharged too soon, and they're not stable enough, and there's not community resources to pick up. So often, I think a lot of the problem is that there's not a seamless kind of transition. So people move into the community. They really need in-home support. It takes a week or two for that in-home support to get set up. So in the meantime, what do? And so, oftentimes they fall through, they end up back in the ER. So that's, in order to discourage that, there's more of an intentional process put in place, right? I know for sure it's readmission. ER might be there may be some leeway. Yeah, there may be some leeway. Yeah. Yeah, where does he go? Good point. The Caregivers Support Act is a newer piece of legislation designed to help caregivers. And there's more of a focus now on bringing that to local communities and having local community networks of people be able to support caregivers. I'm looking at the time and I want to just rush through here. I have a slide that says practices for healthy aging. So let's talk about that for a minute. As women, here's a few things that we can do to help us in terms of pushing healthy aging. Make sure you have social support. Have a network of friends around you. Develop a support system, even if it's a telephone buddy that you call that person. Well, that's very common is the older you get. My mom is 91 and she says to me, I have, all my friends have gone. The question was, what if okay, go ahead. Repeat your question. And especially if you're isolated, it's harder. Yeah. Yeah. Yeah, that's for sure. All of those things are reality. But I mean, there are programs like there's a volunteer program that does a daily hello that's managed by the Area Agency on Aging. So, I mean, there are resources to be able to help plug in. So it's a matter though of, if you're not aware, then you wouldn't necessarily know to ask, but. In the days where we lived in extended families, that's definitely true, but as families have become smaller and more mobile, we don't see that to the same extent. Okay, Ella?
Social support doesn't always have to go one way. I mean, you confirm the issue of volunteering. And volunteering can be done in place sometimes. You develop good relationships with whatever service you're providing over the phone or however. So we just want to make that kind of social support can still begin.
I want to also showcase the importance of brain health and brain trust. There's a lot of research that's come out of St. Louis University that suggests to take on something different than your normal routine for at least 15 minutes a day. So maybe it's learning a language. Maybe it's doing a crossword puzzle. Maybe it's watching some kind of movie that you're not used to, playing a musical instrument, like something that you have never done before, but you take that on. That exercises parts of your brain, and it helps to protect that brain from atrophying and developing cognitive issues. Lifelong education is another one that promotes good health and well-being. So, you know, there's nothing wrong with taking classes at whatever tender age we are. We can all audit classes as seniors at the university at no cost. And, you know, you'd be surprised how students kind of find it interesting to have that diversity in the classroom. And then ensuring that you've got adequate finances. So that's sometimes a tough one, but there are ways to be able to get things covered or paid for that we may not realize. Pharmaceuticals are one good example. Having access to prevention and treatment in healthcare, and taking a look at the impact of chemicals and toxins on your body. I know we're moving into more of an organic age, but you know, there are a lot of things that maybe we had been exposed to for years that really are not that healthy as we grow older. So don't be shy about reading labels and reading up on those labels. And then lastly, consider multiple dimensions of your health. So not just physical, not just emotional, but think about your spiritual and your social health as well. Okay, so those are just a few things. The last part of this talks about policy development, and I think we're almost out of time. So I think I'm going to skip this, but I will make the slides available to those of you who are here, because I do have a Dear Legislator type letter that you can use to make your needs and concerns known to your elected officials. So in conclusion, I just want to say, you know, achieving health for us as women is not something that's accidental. It has to be intentional. And, you know, it's easy for us to find reasons why we cannot do or take care of because we're too busy as caregivers, caretakers. But in the long run, making a few minutes each day, your time for you, whether it be looking after your emotional health, your physical health, social, emotional, spiritual, just take that time for yourself and start to just plot some time on your day, like from 8 a.m. to 8:20 a.m. I'm going to sit with my cup of tea or my cup of coffee, and nobody's going to be bothering me. It's my time for me. So on that note, I want to say thank you for being an attentive audience and interactive, and good luck with healthy aging. And one thing Olga did ask me to mention, this talk comes from two books that I wrote. One is called Healthy Aging Through the Social Determinants of Health by APHA Press. And the second one is Policies and Program Planning for Older Adults and People with Disabilities. And so Olga asked me to mention that she would like to do a tea event at her home and have a book signing. So, we'll send an invitation and, if you want to just come and socialize and have tea, high tea, that's fine too. But we'll do something where we can talk a little bit more about. Yeah. That's right. That's right. Low-cal crumpets, right? Vegan. Fruit and veggies. All right, thank you very much. Yes. You're welcome. Great, I'll let you speak. Well, thank you. Thank you.
Thanks so much to Dr. Jurkowski. That was fabulous. And I know you have so much knowledge and information, and we could ask questions for a long time. And I wish we had that time, but thank you so much.
We have the boss here.
Yes, and Jennifer, can that be watched on the library YouTube?
Yes,
Okay, and the video
the
also.
video up until
Okay.
where we stopped, you'll be able to hear it and everything, and also we'll make sure that the slides get sent out so you can play it on your own computer.
Okay, thank you. All right.
Sorry about that.
Yeah. I wanted to say just something about our next meeting, and you are all invited, members and guests alike. It will be Tuesday, April 16th, and it will be at the University Museum, now the SIUC University Sharp Museum. And the title of it is Shaping Our World, Women Artists in Southern Illinois. So Teresa Fix, artist and guest curator at SIUC University Sharp Museum, will discuss finding her voice through the arts and will share her personal work while highlighting the 2024 Women's Voices exhibit. The name of that exhibit, which is kind of interesting, is Pushing Boundaries. It's on display from now until May 10th. It's nice. Have you seen it? Yes. Okay. This exhibit spotlights and empowers women artists in the Southern Illinois region. So join us for that, and it'll be a lovely evening, I think very inspiring. So the business meeting will be at 6 and refreshments at 6:30 and the program at 7. So once again, thank you, Dr. Jurkowski. Thank you to the Carbondale Public Library, the UNA USA for co-sponsoring our event, and all of you who came in person and on Zoom. And we'll see you next meeting, we hope. Thank you.